Thank you so much, Barb. You've been confined to your hospital bed for days, too tired to even move. There's a tube stuck in your upper chest, and your abdomen is severely painful. To top it all off, every time you've gone to the bathroom for the last couple of days, which has been very frequently, you've had bloody bowel movements each and every time, which is not only disconcerting, but also means that you're going to have yet another tube stuck in your arm for IV blood transfusions. You're experiencing a flare-up of your Crohn's disease. Now, what exactly is Crohn's disease? Well, I'm glad you asked. Crohn's disease is one of the two most common types of inflammatory bowel disease, and it can affect any portion of the intestine, though it usually affects both the small and large intestine. The symptoms of this disease are due to the inflammation that is caused in it. And what happens is that the inflammation causes tissue damage, which causes bleeding and further on down the road, diarrhea. These symptoms can become so severe that a full 60 to 70% of all people with Crohn's disease require a surgical removal of the affected portion of their intestines. So for your visual people, I got a little picture here. You've got the bloody bowels that are really inflamed that you have to take out of the person. Hopefully that'll make this disease anchor in your mind forever and ever and a day. This is probably a little bit more appropriate for the medical types, but you guys are probably fine with it too. We're not exactly sure of what causes Crohn's disease. However, we think that heredity and autoimmune disorders are to blame. What we think happens is that when a person who is susceptible to Crohn's disease becomes infected by some sort of bacteria or virus, their immune system mounts a defense against that disease, killing it off, but also taking part of their own intestine, which leads to the inflammation, tissue damage, and bleeding, along with the diarrhea that is common with this disease. The risk factors for developing this disease tend to support this idea. The first risk factor would be that of age. People who are below 30 years of age have the highest incidence of developing Crohn's disease. Now this is because when you're younger than 30 years old, your immune system is functioning at its highest level, and so that is the age period in which it's likely to take its own body cells with it. Other than age, we also have ethnicity. People who are white, and especially those of Jewish descent, tend to have the highest incidence of developing Crohn's. Family history is yet another risk factor, and it is found that a full 1 in 5 people who have Crohn's disease have a close family member with the disease as well. Beyond that, smoking is another risk factor, and it's the most important controllable risk factor for developing the disease, and it also exacerbates the disease when you actually contract it. Your final risk factor would be environment. People who are in an urban environment tend to have higher incidences of the disease, and this is thought to be because of the highly processed and high-fat foods that are common in the more urban environment diet. So in other words, if you don't want to get Crohn's disease, you don't want to be this guy. Getting it? We just don't want to be this guy, okay? Okay? No. And that's just wrong. Now, the symptoms of Crohn's disease can range from mild to severe. They can come on acutely or develop chronically over a long period of time. They may also go through periods of exacerbation and remission. And these symptoms are, as mentioned earlier, abdominal pain, you'll have bleeding and fatigue, anorexia, and diarrhea. Now, these symptoms mainly stem from the disease process itself, but they also stem from the nutrient malabsorptions that are common in this disease. And the specific nutrients that are malabsorbed would be your fat-soluble vitamins, calcium, magnesium, zinc, and vitamin B12. Interestingly enough, with the bleeding and the B12 malabsorption that are occurring in this disease, anemia is a very, very likely consequence of actually having this disease. There are a number of nutritional interventions that we can use to properly manage this disease. The first thing that you're going to tell someone with Crohn's disease is to consume small but frequent meals. And this will just help ease their digestive tracts by consuming small portions of everything. Another very important consideration would be to decrease the amount of fiber that is in their diet, because fiber is only going to add bulk to the intestinal tract contents, and that's going to aggravate the actual intestinal lining. Beyond that, the fat intake is kept low because they're not absorbing it anyway, and protein intake as well as water intake are really encouraged, however, because protein is going to allow the tissues time to heal and the necessary building blocks, and the water is going to replace all that fluid that you're losing with the diarrhea. Vitamin and mineral supplements are often needed in this disease. Again, malabsorption is a problem. And in cases of severe flare-ups, total parenteral nutrition, or that feeding tube that you had stuck in your chest, is going to be indicated just to allow the contents of the food to bypass the intestines altogether, allowing those tissues time to heal. Beyond the nutritional interventions that we can apply to these people, there are a number of drugs that can also be administered. And we're not talking about that type of drugs, okay? Okay. Drugs are bad. Drugs are bad. The medications I'm talking about include antidiarrheals, laxatives, and anti-inflammatories, usually corticosteroids. Each of these has their own side effects that need to be considered when taking them. Antidiarrheals will often cause constipation. If you're taking laxatives, those will often cause diarrhea. They really work in complementary but opposite ways. Your anti-inflammatories have the most amount of side effects, and for you guys, I just talked to your doctor about those. I'm not even going to that. I will mention one thing. Grapefruit juice needs to be monitored with this medication and other medications as well, because grapefruit juice actually will increase your serum levels of some medications, leading to further side effects and complications of the medication. So if you're on any medication, the actual grapefruit juice, not grapefruits, but the juice, will actually have an impact on your health. As mentioned, Crohn's disease is a chronic disease. There is no known cure at this time, and treatment is mainly aimed at managing the symptoms of the disease. I totally lost my place in the dream. Proper nutrition and medications are essential in treating the disease, and in severe flare-ups, surgical resection of the bowels as well as total parenteral nutrition may be required. However, as we have seen, the side effects and drawbacks of these interventions may have just as large of an impact on the patient's life as the disease itself. This is where I open up for questions, but otherwise, thank you.